Call this meeting of the Educational Assessment and Accountability Review Subcommittee to order. Jay, if you don't care, call roll.
Senator Neal, Senator Titchener, Senator West, Representative Banta,
Present.
Representative Bojanowski,
Here.
Representative Riley, Co-Chair Deneen,
Here.
Chair Truitt.
Here. All materials have been sent electronically to all of the members. Are there any members that's seeking introductions? Okay. If not, our first item on the agenda is approval of the minutes from the July 14th, 2025 meeting.
Motion.
And we don't have quorum right now, so we'll have to hold off on that for just a second. So we'll go on to the next item on the agenda, which is the Office of Education Accountability is here to present its report on the Early Childhood Regional Training Centers. So, ladies, if you don't care, I'll let you introduce yourself and you all may begin.
Good morning. I'm Sabrina Smith, OEA Research Analyst.
Good morning. I'm Deborah Nelson, Research Division Manager for the Office of Education Accountability.
Okay. Good morning. The study reviews the early childhood regional training centers across the Commonwealth. Program requirements, population served, and expenditure data and oversight challenges will be discussed. Regional training centers, or RTCs, are federally funded centers that have provided training and support to preschool personnel since 1990. They are housed in individual districts, but are designed to support personnel in all of the districts in each of the 5 regions as indicated on the map. KDE contracts with 4 districts: Anderson, Ashland, Callaway, and Simpson County, and 1 cooperative, the Kentucky Valley of Education Cooperative, to operate each RTC. The stars on the map represent where the RTCs are housed. Each center has 3 employees, 1 which is a director. EARS requested that OEA review funding, student population served, and federal and state requirements for RTCs. The study finds that RTCs provide valuable training and resources relevant to targeted populations, and that these services are consistent with state and federal policy requirements. However, greater oversight by KDE is necessary to maximize equity, fiscal accountability, and program efficiency and effectiveness. In addition, the structure of the programs, which has been in existence for 35 years, should be reevaluated to determine if the model used is the most efficient and effective model. OEA used a variety of student, fiscal, and staffing data from KDE. In addition, we interviewed KDE staff and communicated our findings to them prior to finalizing the report. In addition, OEA reviewed the contracts or MOAs that include RTC's proposed budgets, goals, and deliverables. In addition, we looked at the RTC quarterly project budget reports. These are the munis reports that are sent to KDE when they request funding that they have spent out of these RTC grants. This is the outline for the presentation. First, I will go over state and federal requirements. Then we'll look at population served, revenues, and then some oversight issues that are fiscal and had program impact. The Federal Individuals with Disabilities Act, IDEA-B, preschool grant allows State Department of Education to set aside funds to benefit children with disabilities ages 3 to 5. Funds can be used to provide direct services, technical assistance, professional development, and other type of services. As shown on the previous slide, federal law does not mandate having early childhood training centers. However, Kentucky law currently requires them, and that these centers also assist personnel working with at-risk preschool children. RTCs are required to provide peer-to-peer training, consultation, technical assistance, and materials. One example of the materials being offered is that each of them have a technology lending library, which I'll discuss later in the report. And finally, statute requires KDE to use federal funds to support these centers. OEA's analysis of RTC contracts indicated that, consistent with federal requirements, RTC activities are also aligned with the state goals for preschool-aged children. Each RTC contract listed 4 major objectives, including to provide behavior interventions and positive behavior support training to districts, provide training to districts on evidence-based inclusive practices, which are instructional strategies and interventions that have been proven through scientific research to improve outcomes for all students. Provide IEP development to determine the needs of a child with disabilities. And finally, provide information to districts highlighting ways to increase their transition to kindergarten activities and parental involvement. While these objectives are focused on children with disabilities, most are also beneficial to at-risk students and other students. Before leaving this slide, I will note that, related to the first objective, Appendix D of the report provides data indicating a need for behavior interventions and supports at the pre-K level. Behavioral challenges affecting pre-K and other students will be included in our discipline report in a few weeks. We will now review the population served by each RTC. This slide will show the number of preschool students in each RTC region by category. Students with disabilities comprised 39% of preschool students across the state, though as you can see, the percentages varied widely. At-risk students comprised 29% of preschool students, and the remainder of the preschool students shown in yellow are enrolled in preschool, but they're not eligible for state funding. The figure also shows that the number of students in each RTC's region varies substantially, and the Anderson RTC service area includes 5 of the top 10 districts that have the largest student membership in the state, including Jefferson County. As would be expected from the previous slide, the percent of preschool teachers also vary among RTCs. The Anderson County RTC serves 2.5 times as many teachers than the Ashland RTC. In compiling data for the preschool personnel working in districts within each RTC region, OEA staff noted some issues with records being incorrectly recorded on the professional staffing data and classified staffing data that districts submit to KDE. It's very important that these data be maintained accurately to be available to decision makers. We will now move to the review of RTC revenues. In fiscal year 2024, KDE received $11.2 million in Idea B preschool funding. Out of that, they sent $8.37 million to districts to help support their local preschool grants. KDE retained about $575,000 for state administration, which left $2.3 million in state set-aside funds. Of that, $2.26 million went directly to the RTCs to provide technical assistance, professional development, and support and for innovative programs. In 2024, each RTC received about $448,000 in revenue, except, as you can see, Anderson County received an additional $23,000 due to serving the largest student and teacher population. This table calculates the funding for each child with a disability or for children with a disability and at risk as a group. For each group, funding per student vary widely among RTCs. Anderson County receives substantially less, and Ashland RTC receives substantially more than most other RTCs. Ashland RTC received 3.6 times more than Anderson in per student revenue for students with disabilities, and 3.8 more times more revenue per state-funded student with a disability or at risk. This brings us to our first recommendation in the presentation. KDE should review RTC district service areas and allocation of grant funding to ensure equitable access to RTC resources and services by participating districts. Before discussing our review of oversight issues related to fiscal and program impact, we will review the RT structure and the model. Currently, as we have stated, there are 5 centers, each led by a director and supported by a small team that includes instructional coaches, and in 3 centers, as you can see, an administrative assistant. So we're kind of going to discuss here the difference in all the paperwork and oversight that's needed. So each center has their own memorandum of agreement with KDE, and the directors are responsible for implementing the 4 previously mentioned objectives. But under each of those objectives, there are several different detailed activities that the RTCs must complete. In addition, they have to document a lot of data and submit to KDE that we're doing this, we provided this training, this many people come. And along with that, they have to also provide quarterly budget reports and an annual end-of-year report. And not only are they going to provide this, ultimately, KDE should be reviewing all the submitted materials to verify compliance and evaluate the impact of these RTC centers. So before we go over the concerns on the next slide, I just want to note that OEA conducted a summary review. We did not go in and do a full audit. That was outside of the scope of this office. We did not go to any of the RTCs and review their purchase orders or invoices. We just looked at a higher level. For our review, we looked at each of the MOAs and the contracts, the end-of-year annual reports that they submitted to KDE with their goals and deliverables, and we analyzed their expenditure reports from both the annual financial report and the project budget reports that were sent in. During our review, we did find several fiscal issues, which is listed in Appendix C of the report. I just want to share a few examples on the next slide. To be clear, we did not find anything that suggests intentional wrongdoing, but the findings do point to a need for stronger guidance and oversight by KDE. OEA identified a number of questionable expenses. The first relates to indirect cost, which basically indirect cost is something that districts can charge for overhead expenses such as rent and utilities because they're providing services to that grant. One RTC charged an indirect cost rate that was 4 times greater than the indirect cost charged by another RTC. In addition to that extremely high indirect cost, that RTC charged almost $17,000 for building rental space for the RTC staff to be housed, which should be covered normally under the indirect cost rate. In addition, one RTC host district may have used their own funds allocated to the RTC to pay for preschool expenses from that host district. Proper recording of revenue and expenditures is important to ensure that RTC grant funds are used properly to benefit all of the RTC districts. Currently, KDE is also having these host districts record the RTC expenditures in Fund 2 on their financial reports. Because they are doing this, this mingles these funds in with district funds and looks like it's the district's revenues and expenditures when actually the districts, these RTCs, should be recording these as agency funds outside of the regular district's finances. So these findings, along with the findings we talked about in the staffing earlier, leads to the following 2 recommendations. First, KDE should ensure that RTCs apply correct and uniform coding practices for both expenditures and staffing classifications. For example, KDE should require that the RTC financial accounts be established as agency funds rather than district funds. Recommendation 3 is that KDE should review RTC budgets and expenditures to ensure they are consistent with contractual requirements and state guidelines. These requirements include, but are not limited to, indirect cost rates, and exclusive use of RTC grant funding to support RTC activities. So the next few slides will discuss some overall program issues we found. Our review of the RTC documentation that was submitted, along with a review of annual reports, found that data to demonstrate progress toward those goals were often incomplete or missing. In addition, the information provided did not provide enough detail to assess quantified goals. And finally, it appears that the technology lending library may be underutilized. For example, in one RTC's records, fewer than 5% of the 746 available devices were even checked out in one quarter of fiscal year 2024. Based on OEA's findings, questions raised in this report about fiscal oversight and program impact merit evaluation of the RTC model. When RTCs were established 35 years ago, separate regional delivery models were common. Currently, most support provided by KDE to local school districts follows a model in which regional support staff are employed directly by the Department of Education. Since the centers were established, technology has evolved, increasing online options for training. In addition, RTC staff reported a greater attendance rate for these online training options versus in person. In addition, materials can be quickly and easily distributed throughout the state from a central location. The 5 centers may create inefficiencies in that each has its own director and may be difficult for KDE to monitor given the number of contracts, each covering a small number of employees. This may create undue administrative burden both for the department and RTC staff. Therefore, OEA recommends the KDE should conduct an evaluation of the current structure of the early childhood regional training centers to assess whether the existing model effectively and efficiently delivers support services to school districts. This evaluation should include a cost comparison between the current regional model and an alternative model in which staff are employed directly by the KDE. These findings should be shared with the Education Assessment and Accountability Review Subcommittee and to the Interim Joint Committee on Education. Based on findings in the report, the General Assembly may wish to consider amending or removing requirements of KRS 157.318 related to early childhood regional training centers. The study concludes that while RTCs provide very valuable training and resources to children with disabilities and at-risk students, greater oversight by KDE is necessary to maximize equity, fiscal accountability, and program effectiveness. In addition, given advances in technology and alternative service delivery models since RTCs were established, KDE should evaluate whether the current 5-center structure remains the most efficient method for statewide support for staff who support preschool students with disabilities or who are at risk. Because statute requires that KDE use federal funds to support these centers, statutory changes would be necessary to permit alternative use of federal funds. This concludes our presentation, and we will be happy to answer any questions at this time.
All right, thank you. I guess I'll start first, and I hate to admit my ignorance, I guess, but been in education for about 26 years, and before this report, I have never heard of an RTC. You know, and I know that's kind of crazy, but maybe that's just me not being familiar with what's going on around me or what. But I have preschool in my building, but I've never come in contact with someone at an RTC. So you mentioned that you had presented this to KDE and the recommendations. So I'm new to this, so I'm just wondering, what type of response did you get back from KDE when you had those talks about your recommendations?
Basically, we met as a group to discuss them informally. We went over our findings and shared with them where the issues were, and we did not get a formal written response back from them or any real response. They did have some questions about the expenditures, but other than that, we have not really had any correspondence from them on our findings themselves.
All right. So to follow up on that, would that be our job in this committee to make sure that we hold KDE responsible to doing some of these recommendations?
Yes, our statute does not require the department do any of our recommendations. So unless you all bring them back or ask them for an update or even ask them to do the evaluation, they don't have to do any of our recommendations.
Okay, thank you. Representative Bojanowski.
Okay, so thank you very much. No, I didn't know about these agencies either, but I'm just in the classroom. I'm not in a position where I probably would. So talking about the requirement to have the RTCs, you said that we have a state statute requiring it. Is
Yes.
there anything in the federal grant that requires that?
There is not. We looked back when preschool grants were established back in the feds, which was like 3 years before we entered preschool. And they actually, back then, the federal grant kind of suggested that you have these centers, which totally made sense because when we started preschool back in 1990, like that was our first time. And so you wanted these centers to be close and be able to help and support these, all of the personnel. But at this day and age, it just may be a good chance for them to look at. It's a lot of money being spent and a lot of time spent on the staff supplying documentation and KDE to do the oversight that just might be a better model than the model we're using today. But currently, no, there is no federal requirement that you have these. It is state requirement.
And may I ask one follow-up? So
Yeah.
as I was reading through, I didn't read the whole report. I read the slides and then part of the report. But I wondered, how do other states handle this type of a grant?
That was not part of the study, and I'm sorry, I did not even look to see if anybody had if you all want, the co-chairs want, I'll be glad to look to see if I can find anything on that for you. But it wasn't part of our study.
Thank you.
Senator West.
Thank you, Mr. Chairman. You shouldn't feel bad, because I feel kind of the same way. I really don't know enough about this topic to have all the answers for sure. So my questions will be digging down a little bit further to learn more. That I'm sorry I didn't know about these problems. But when they just operationally how it works, so they'll go to the regional training center for training. Is there office space purchased? Is it leased from the school, or how does that work?
So the ones that are at the school building, they're inside of the district. The one through the co-op used to be housed in Berea Independent. Berea actually was the first one to have the contract. They gave it up, and so then KDE contracted with KVEC, and for a while they were still at Berea Independent, but this past year they actually moved them into a different building that is rented.
So the monies are used for conference room space, places where people can congregate, right, to
Yes.
be instructed, and office space for the director and their assistants and those sorts of things.
If that's specific, the report will show you each expenditure by RTC for that 2024 year. There's a lot of variance in which some of them spend their funds on, if you look at across the different RTCs. But most of them do provide training. They will go on site to provide training. They will also have a big yearly training. And then they'll have some regional type training, like Anderson County, I believe, comes here in Frankfurt and rents the hotel, the Capitol Plaza Hotel, and did some training there. And then these staff also go to themselves to national training as well. So there is a lot of training and traveling. And then, of course, I believe one of the co-ops rents a building, we think, to house all these technology devices, to store them.
Gotcha. So could I continue, Mr. Chairman? So if we change the model, so let's say we limit the number of directors and we focus more of the effort on instruction, and we focus to a model where we are leasing space for a certain period of time, or we're allowing the co-ops already have space, these types of
They
spaces that we could lease from them. If we change models, would we still be able to pull down federal funds? And if we did so, could we increase the amount per pupil that each student would receive for their teacher?
Absolutely. Basically, right now, you're requiring federal dollars to be used for these regional training centers. So technically, you could just do away with the statute. KDE already is allowed to pull these set-aside funds, and then they can decide how these funds can be used. They can be used for district personnel at KDE to help districts, as well as they could use those funds to send more to districts for the cost of preschool students, or even they could have a separate grant, maybe set aside some of those set aside funds to be spent on innovative practices and things like that. So that is definitely an option.
So just to be clear, I think you answered my question. If we change the model, these are RTC federal dollars. They're specifically for our RTC, correct?
That is incorrect. These are Idea B preschool
Gotcha.
federal dollars that can be used for multiple of things.
But if we change models, it would not endanger those funds?
Absolutely not.
Okay.
No.
Thank you, Mr. Chairman.
Very interesting report, with all the talk in our state about preschool and how important it is. And it's no secret that I'm a big advocate of preschool. But I think this raises definitely some questions about how our funds are being used. And how fair they're being used. I seen there that, there was some, the center that had the most students, that probably had the most need, considering it was Jefferson County, were getting the least amount of money per student, as opposed to some of the other centers who received the same amount of funding, but less students, so obviously more money per student. So, I mean, it's one of those things that I would love, and I know we can't get this, but I would love KDE's response to this and kind of what their thoughts are on this. And maybe that's something we can follow up with them on to kind of see, do they have the capacity, would they have the capacity to oversee this as opposed to using these monies on these RTCs. And I have no problem with them. I didn't know they existed. And so they may be wonderful things, but we need to do a little more digging. So I appreciate this report. And if there's no other questions at this time, I will entertain a motion to accept this report. All in favor say aye. Aye. Any opposed say nay. All right, motion passes. All right, I guess, do we want to go back and now do our okay, so let's go back one step, and I'll entertain a motion to approve the minutes from our July 14th, 2025 meeting. Motion. All right, motion. Second. All in favor say aye. Aye. Any opposed say nay. All right, motion passes. Okay, next item on the agenda. Each year, this subcommittee performs its oversight function by approving the research agenda for the Office of Education Accountability for the following year. Education staff reached out to members over the past 2 months to request topic proposals. After collecting the proposals, the co-chairs met with OEA staff and selected the 3 research topics to be included in the proposed 2026 study agenda, one of which is the annual district data profiles. A copy of the proposed 2026 study agendas have been included in your meeting materials. OEA staff are here today to present that document, and it looks like they're up at the table, so I'll let you all introduce yourself once again, and you all may begin.
Yes. Brian Jones, I'm the acting deputy director at OEA, and with me is Dr. Deborah Nelson, who runs our research division. And so that we can move into the proposed studies, I'll turn it over to Dr. Nelson, and she'll give you a brief outline of what the 25.
Could you pull your microphone up a little bit closer?
Dr. Nelson will give you a brief overview of what's on the agenda for the 25-26 proposed studies, and also answer questions on those. So I'll turn it over to Dr. Nelson now.
Thank you. So for your review and acceptance for our 2026 study agenda, we have 3 topics that have been proposed. The first is the district data profiles for the 2025 school year data. In addition to the metrics that you're used to, it has been proposed that it include an appendix that shows the number and % of students moving to private school and to homeschool by district. Also, this year's profiles will include an appendix that specifically addresses any data quality issues that OEA notices as we're compiling the data, because that is a big part of this project. As we review the data every year, we notice issues that affect the comparability of data. So this year's report will kind of outline those issues specifically should we find them. The next will review facilities funding, including state policies and procedures related to funding and construction upgrades. And it will include how projects are prioritized and funded, and any processes that address efficiency, as well as any models that exist nationally to address issues identified in the Commonwealth. The third, it will review implementation of statutory provisions for early literacy. It will gather information from districts related to provisions of the statute, such as reading programs, assessments, and support systems, including the numbers of specially qualified staff who implement those systems. It will also review assessment data. Actually, it will collect information about assessment data, including the numbers of students in early grades who are not meeting benchmarks or district standards, and what is being done to support those students. Finally, it will report any district implementation of policies that apply specifically to students with dyslexia.
Okay, thank you very much. Any questions? Well, just real quick, you talked about what you were going to add in the appendix. The last item you talked about were any findings. Could you explain that just a little bit more?
So when we're reviewing data every year, we notice we don't just pull down the data and compile it. We'll look at changes from district to district. Say, oh, this district had a huge decrease in the number of, let's say, classified staff. Do they not have as many staff? What happened? Well, we'll maybe call the district and we'll find that they have moved to contract staff. So we're not reporting the contract staff because those staff are not entered into CSD. So we are underreporting the number of contract staff in certain districts. I mean, the number of classified staff if those districts contract for staff. So this is an issue that we have brought up with the department before. Those numbers for contracted staff, correct me if I'm saying anything wrong, Dr. Sabrina, but that they're supposed to be reported to the federal government. They're not collected and reported. So we are underreporting classified staff and some certified staff who are contracted. So that's just one issue that affects comparability from district to district. These are issues that we bring up informally with the department, but adding this appendix will allow us to kind of outline these issues that really affect comparability. We brought up one last year in contract staff with Cloverport Independent. And these are issues that we bring up informally. It'll just really allow us to keep track of it and include it actually in the document so the committee can follow along in terms of how those issues are being addressed.
All right, I think that's a great idea. All right, Senator Dean.
Thank you, Mr. Chairman. In looking back over your the study that we're proposing here on the KFIX, I was looking back at I guess the last one was 5 years ago. There were several recommendations that were made to KDE at that time. I would like to make sure that in the updated report that we have whether or not those recommendations were followed through on. I know there is some things that I have questions about from that report that I don't know if KDE followed through on, and I would like to get an update from that. So you can see those recommendations. They're your recommendations from your report, and so as I was reviewing those, I would definitely like to hear what KDE steps they have taken to better report what those facility needs are and how they're reporting them. So I appreciate that report.
Absolutely, Senator Deneen, we will do that.
I think it's KRS 157420 is one I'm particularly interested in. The KDE was required to create regulations for KFIX. At the time of 2020, there was no regulations created. I want to make sure that those regulations have been created in this time period and if they are being implemented today. And any needed additional requirements. Thank you. Thank you, Mr. Chairman.
No problem. All right, with no other questions, I guess I'll entertain a motion to approve the 2026 research agenda.
Motion.
All right, motion in a second. All in favor say aye. Aye. Any opposed? All right, very good. Well, guys, I really appreciate your all's information throughout this meeting. It was, to me, it was very eye-opening. And that was the last item on the agenda. So our next meeting is going to be on November the 4th at 10 a.m. in room one. This room here, 131. So at this point, with no other business, I'm going to adjourn today's meeting.